Thank you, sir. So I'd like to now invite Dr. Deepak Megur, excellent teacher, great surgeon, great YouTuber. So, and congratulations on your award.
Thank you so much. Respected chairperson, I think I'll be speaking on the cataract surgical training aspect of it, specifically the surgical training aspect of it. And I wish there are more trainee students here as well, because this talk is going to be including both the trainers as well as the trainees. So I'll be speaking on the conversion from a novice to an expert surgeon. I think the first thing a trainer or a trainee has to imagine that, for a trainer, I think you need to imagine that when we start training, that once upon a time, the trainer also was a novice. I think if you recall that stage of your career and what difficulties we went through that, teaching a novice becomes much more easier. Over a period of time, we just tend to forget what all difficulties which we had. And it is a journey from being a novice to develop a reasonable expertise. I think remembering our struggling days would definitely help a trainer. And for a novice, I would say that it's just a matter of time. Anybody can, over a period of time, can reasonably harness his surgical skills. So as we all know, surgery is skill based, and there are different stages of skill acquisition. And the psychologists have classified the skill levels into these different stages. And I think the most important part of us to understand is that it's almost impossible for us to directly jump from one without going through any of these. I think each one of us would have to go through these, and to begin with, all of us would be novice. That is one thing to understand. And what changes over a period of time is, from a novice to become an advanced beginner to proficient to being an expert. I think the most important thing would be the quality of decisions which we take when we are a novice, and as the time with reasonable expertise. The quality of decisions which we take, that is the one thing which actually is going to change over a period of time. And the best part, the beginner will always think that he's very competent, because he's totally ignorant about his incompetence. So that is where we begin with. The surgery is actually when we begin. The novice is almost unconsciously incompetent. He's not even aware of his deficiencies. And actually the real beginning of this training process starts when he becomes conscious about his incompetence. That is where the training actually begins for any surgeon. And over a period of time, gradually we grow to become consciously competent. And over a period of time, the eventual goal is always to become, competent, and we are unconscious about competence. The most common question asked by a trainee: how long would I become? Will I take a time from becoming to become an expert, like something like, say, Dr. Suhas, Dr. Vidya is there? How long would it take? Well, obviously the answer would be, my answer would always then to go and look yourself in the mirror. So how long the journey is going to become is basically depending upon the candidate or the trainee himself, the surgeon himself. So it is going to be very cliched answer that, what are the things which could be like, So I'd like to just try to divide the whatever soft skills or hard skills you want to have, these 7 commandments, and I'd like to delve into each of them individually. Most importantly, I think rather than having blessed with some good surgical hand or eyesight, I think attitude is something which is going to differentiate how fast you're going to learn. So we should never forget that the patient's interest and their well-being is our only goal. If this is ingrained in our training from the first day itself, it is going to ease a lot of it. There's no other business for us. We're here only for our patients, and this dictum is going to apply whether you're a beginner or an expert. It makes decision making very, very simple. During the learning curve, if you are struggling with the case, if your patient's interest is priority, rather than you trying to be adventurous, take the help of a senior surgeon. And when you're in a private practice, always refer to a colleague. And if you are already an established practitioner, or decision making like buying in equipment, consumable, etc., if we keep a primary center that patient's interest is a primary goal, then most of the things will be sorted out very, very easily. The first thing to learn, obviously, is to have the right attitude. That is what is going to differentiate you from how quickly you're going to learn, rather than focusing on the surgical aspect of it, as I say. And second thing, for all trainees, they should learn to understand to say wow. Start to appreciate your peers or your seniors or something, rather than being cynical and just tell comment that there's something blessed with something else. And third would be you getting inspired. If you learn to say wow, then that's when you get inspired. It's a popular saying that inspiration is just only 1% and perspiration is 99%. But for that 99% to come and kick in, you have to have that 1% spark. If you don't have that 1% spark of getting inspired, there's no point in having your 99% perspiration. So these are some basic things, and obviously finding a mentor nowadays is extremely easy. It can be offline, it can be online, and if you are having a mentor, whether you're in person or offline, I think trying to learn the art of thinking from your mentor is far more important than learning, how to hold the surgical instruments, all those things. Get into the mind of your trainer, how is he thinking? That is the most important part, which I would like to train my trainee as a trainer, rather than the basic necessities of surgical skill. Basically, the surgery is nothing but it is a way of thinking. And the next would be you have to train your trainees to the habit of pursuing excellence. There's nothing like chalta hai attitude. The only goal you should have is to have excellent outcomes for your patients. So Rancho was right when he said you don't chase success. You just pursue excellence, and success will follow pants down. And it's very cliche. How do you pursue excellence? It's always focus, passion, dedication, and hard work. There is no shortcut for it. Absolutely no shortcut. It's a very cliched statement, but it is stood the test of time. That's how it's going to be. So if you have these goals, you're having excellence is your only criteria, then you ensure that your training is on the right side. Third most important fear a trainee has, or a myth, I would call it as a myth, that they believe from our childhood they say that a great surgeon is born with great hands. How much minute I have? Over? Okay, I'll finish with this. So a common perception is that great surgeon is blessed with great hands. I believe that it is a myth. Surgery is absolutely not done with your hands, but it is done with your mind, and it can be learned and it can be taught to every novice surgeon. So in our local language called Hatgun or Kaiguna. So I believe that it's all over a period of time each one of can develop this and it can be learned and taught. So what we basically read, the surgery is done with the mind, and we need to train the mind of our young trainees. That is where the fallacy is, or the lacuna is now. Just teach them the art of thinking, and everything else is falls in place. So training the mind is probably more important than training the surgical skill. But of course, we need to ensure that they understand that knowledge is the real power. The surgeon has become great because he, over a period of time, has assimilated enough experience, knowledge, and education. And all these have resulted in making his mind much more superior than an average surgeon. I think with these things, I would like to conclude my presentation because of paucity of time. Thank you so much for your attention.
Thank you so much, Dr. Deepak. Really brilliant presentation. I'd like to ask a question to Dr. Megur sir. So you have been a great teacher, and I think a lot of students have learned just by observing you operate. Whenever you speak to your students and when you actually teach them, when they are doing the surgery, do you actually handhold them into how to exactly use their hands, or how exactly do you go about that process? For example, a simple phaco surgery.
Well, it's a good question. Yes, when I say handholding, it's truly handholding. But very often, like when you're doing a trench, now with 3D, it's a different ballgame altogether. With 2D, unless you're seeing those side scope, it's not possible to know that depth. So I tell them, the trench you have to do in a particular way. He'll try and understand what you do, but no, if you can't do it, you kind of hold his hand and take him through it. That you need to do a couple of times. And once he gets into that group, you know that he's doing it okay. So that means, I fully agree that the surgical hand is a myth. No, it's not. But everyone can eventually become a good surgeon. See, some will have better skills in their hand, that's for sure. Maybe they have developed it from the childhood. But someone who's not, when he comes into residency, to spend a little more time on it, I'm sure even he can be. Because the reason I'm telling you this is, there's a big difference between the Indian residents when they come there to learn, and then the foreigners when they come for a hands-on training. Now we have done lots of things before we start training. Whereas a foreigner when he comes, he is zero. He has not touched the cataract. Even then, in 3 weeks, what he learned is exactly the way you want, because his mind is clean, and you are teaching the way you have to do, and they just copy. That doesn't happen with some of the lessons because they have learned at different levels from different people, and it's all mixed up. But then hand-holding is a necessity.
So, and just one last question. Many times when the student is actually operating and he has a problem, it's very easy for the coach or the mentor to say, okay, wait, I'll take over. So somewhere that kind of diffidence gets in, that whenever there is a problem, I just stop and then somebody else will take over. So somewhere their confidence gets a hit. Suppose, because especially if they go back and have a complication, then every time they are in a problematic situation, they just want to give up. How do you actually handle the student in those situations? Does a teacher actually go up and say, no, you go ahead, let's see what happens, don't worry. If you think you want to dredge a little more deeper, at that point of time, when he takes that decision on his own instead of giving up and somebody else taking over, and he says that yes, now I'm able to cross that, probably that will boost his confidence. So what is the thoughts of the panel on that?
My thoughts on that, my thoughts on that are, it all depends on what is at stake at that particular moment. Now let's say there are some surgeons who just see on the screen or the back through the binocular and just continue to guide them. But then, let's say the rexis is slightly going out, and you are kind of guiding him to do it properly. Because even if it slightly goes out, and even if it totally goes out, nothing great is understood. But then, if he's already caused a PCR, and then if he doesn't know his basic steps, like he has to stop, load down things, and then put him in squat and thought. These are the things he should kind of rehearse before he actually sits to the screen. So obviously he's going to do it. You are only going to assist him to do it. But if you think the nucleus is about to drop, if you don't intervene, probably you will ask him. He would also know his limitation. It depends on different cases.
Dr. Rajesh, sir. Yeah, please answer. One last comment and then.
Yeah, I think one of the point which actually Sir really made is it's really case dependent basis. If the case where you feel the person is capable to handle further, you can let go and see. But if you feel at any point you have to take over. See, being a training institute, we shouldn't be in a fact that okay, it's fine, it's a training institute, complications happen, chalta hai. We don't monitor. That is completely wrong. We have to, at the end of the month, we have to see how many cases of complication are happening. Then we have to monitor, audit. Why was the complication happening? I mean, was the training, it shouldn't happen. Actually, normally at the end, the outcome should be good no matter what, even if it is a training institute. So we have to really be aware and look into it, definitely.
Thank you.